Hello, my name is Dr. Gerald Chodak. In this video, I want to give you information to help you go about participating in the decision about managing your localized prostate cancer. Increasingly, patients want to play a role in that process, and you certainly have every right to do so. And there are several things that you can do to make that process worthwhile and helpful. First of all, realize that your cancer didn't just develop yesterday, and you don't have to make your decision overnight and get treated tomorrow. You have time to sort this out and gather all the information. And there's three places to get information to help you with this process. First, of course, is your doctor. The second is reading from books, journal articles, or newspapers, or certainly the internet. And the third one is talking to other patients that have had the diagnosis and gone through a particular therapy and get their anecdotal story. Of these options for information, most doctors believe that information you get from anecdotal stories has the greatest bias and has the least likely chance of being useful to you. That doesn't mean you shouldn't talk to other patients. Just keep in mind that what happens to one or two or three patients may not be a good indication about what really happens when large groups of men undergo a particular therapy. So maybe it should just play only a small role in your decision process. When you tell a patient that they've done well with a particular therapy, patients assume they'll get exactly the same result, which is of course not necessarily true. Now, having said that, when you look on the internet or read journal articles, you can also have a potential bias because no one is policing that information. People are free to write whatever they want. So you need to be careful that when you read that material, you'd like it to be based on good scientific information from published journal articles, not just represent the opinion of a particular doctor. Without the science to back it up, there may be a potential bias. Now, there's also a potential bias that can occur from talking to your doctor. Doctors have both intentional and unintentional biases. An intentional bias is surgeons telling you that surgery is best for you over radiation, or radiation doctors telling you that radiation is best for you, or someone who does robotic surgery saying that you should have a robotic operation. Those biases exist. Be aware of them. There's also the unintentional biases that can occur when a doctor gives you information. For example, studies have shown that if I tell patients there's an 80% chance for a good result, that many patients will be favorably disposed to choosing that option. On the other hand, if I tell them that there's a 20% chance for a bad result, a lot fewer of them will make the same choice, even though the information is exactly the same. So where there is this potential for a bias occurring in how the information is presented. And what you should try to do is gather the information in terms of what are the good chances, or the chances for a good result and the chances for a bad result. Get a more complete package about what each option offers. And that will help you. Now, if you are getting the information from your doctor, you'd like to get three pieces of information. Not all doctors will give you this information. You'd like to know what are the odds of surviving in 10 years or longer, what are the odds your cancer is going to recur, and what are the complications that can occur with each of the options available. The complication rates are important to gather, and it's important where the information comes from. A doctor can tell you what they think are their results, or they can use validated questionnaires to survey their patients, or they can simply quote for you the results of some other doctor at some other institution. Clearly, you want the results from the doctor who's going to treat you because not all doctors get the same results. And you really want it from a validated survey because we know that only that will give you a more accurate information about what to expect from side effects. So don't be afraid to ask your doctor, what are the side effects? What are the odds they're going to occur? Are they your results? And how did you get that information? Did you use a survey instrument or not? All right, now you've gotten the general information that is necessary about each of the options available. What are the facts that we can tell you at the present time? Because we don't have good studies comparing many of the treatments. The best we can tell you is that surgery and external radiation and seed implantation have similar survival results at the end of 10 years. We can't say a whole lot at 15 years. We also can't say much about the survival for treatments like HIFU, cryosurgery, CyberKnife, or proton therapy because they haven't been published. There are theoretical advantages to both CyberKnife and proton therapy, but as yet they have not been published in a way that allows us to assess them and make comparisons. This doesn't mean the treatments are not as good. It just means that we can't say to you they are as good. We can't say to you the side effects are lower. We can't say to you the survival is comparable. That information hopefully will be forthcoming. Other facts we can tell you: surgery is considered to be very aggressive, and because if your cancer is localized and you take it out, theoretically it's gone. Having said that, there's no proof that it's a better therapy. What you do get with surgery, however, is a more immediate result, so that your PSA is going to drop down low very quickly, whereas it could take a much longer period of time with the other options available. We can also say to you at the present time there's no evidence that doing surgery by robotic is any better than any of the other options available. So robotic surgery versus open surgery versus perineal surgery, it's not the technique that matters, it's the surgeon. We do know that giving higher doses of external radiation seems to be better for you than using the lower standard doses. We know that IMRT gives you a lower chance for some of the side effects. And we also know that if you have an intermediate or high-risk cancer, that adding hormone therapy for a certain period of time, in addition to radiation, will give better survival results than radiation alone. Beyond that, we have a lot of information that is still missing. So try to gather that information as best you can. Recognize that some of the information is missing. So now what do? Well, my suggestion is that you write down on a piece of paper for each of the options you're considering, the chances for a good and bad result, the chances for long-term survival, and also the odds of getting a complication or not getting a complication. Looking at results in terms of PSA failure or PSA recurrence is not considered adequate. We really want to know overall survival. And then you need to factor in your own personal values. Some people are more concerned about quality of life, other people are more concerned about survival. Some people value potency over urinary control or vice versa. This is critical because each of the options has slightly different results in terms of these specific outcomes. And so factoring in what's important to you will be a necessary step to picking what the best therapy is for you, which is not necessarily the best treatment for another individual. When it's all said and done and you've gathered the information, you've done the best that you can do. You've done your due diligence and you're in the best position possible to share in this decision. And you should feel comfortable that you've done your homework and you're making a decision that's an intelligent one and an informed decision. Hopefully this information will be useful to you. Thank you.